coronavirus numbers, they are on the rise, has a lot of people worried. In today's To Your Well-Being, we're breaking down the new numbers and the importance of social distancing. Cone Health's Chief Physician Executive, Dr. Bruce Swords, is joining us now. So, Dr. Swords, let's talk about this. Cone Health has been caring for, 90 plus COVID-19 patients for the past several days. And this alarms you. Tell me why.
It sure does. Thank you for having me. We have 90 plus patients in our facilities for the past several days, even over 100 at times. And what's concerning is that a few short weeks ago, maybe 8, we had 1/3 of those cases in our facilities. And so what's concerning is the rapid rise in the number of patients that we have from mid-30s to upwards of 100 patients in our facilities. And that rapid rise is concerning because we don't see that tapering off anytime soon.
And I think when a lot of people heard that the number of cases was going up, I think that they were assuming that it was just people testing positive, but not people being sick. But this is a totally different thing that we're talking about here.
That's right. It's both. So there are more people testing positive, and that's because there's more coronavirus in our communities, and a subset of those people who are infected get extraordinarily sick and require hospitalization. And unfortunately, as we know, some of those patients die.
I know that Cone Health, and we're trying to think of, okay, do they have enough beds to take care of these patients that you have now? And if you're thinking that it's going to exponentially go up in the next couple of weeks?
It's a real concern. Certainly we have the number of beds and staff members and doctors and nurses to take care of the patients we have now. And we will do everything we can to take care of as many patients in the future as we need to, but our resources will get constrained, and we may have to start shifting resources to the right patient. We don't know what that will look like, but we have to get this under control now.
All right, so when you say that you might have to shift it to the right patient, what does that mean?
Yeah, we're not even sure what that means. We do know that if resources get constrained, there may have to be some really tough decisions that are made. We can recall many months ago in European countries where doctors had to make really tough choices about who was going to get what care. And thankfully, we haven't had to do that. We don't think we will have to do that, but it all depends on how engaged our community members get in controlling the virus and the spread of the virus.
All right, well, let's talk about that, about what do we need to do as a community differently?
Tanya, we've been talking about this for several months, and I'm not sure anything needs to be different other than everybody needs to participate. And so we know what works. We know that wearing a mask, a real mask, works. We know that you need to wear the mask over your mouth and your nose, not under your chin or just over your mouth. We also know that you need to stay away from each other and distance yourselves while wearing a mask. It's not one or the other, it's both. And then, of course, wash your hands because the virus can stay intact on solid surfaces. So the message isn't doing anything differently. It's everybody has to participate. And unfortunately, not everybody has participated in these COVID rules that we've designated.
Mm-hmm. So I know some of the recommendations from the governor are encouraging people to change their holiday plans. And what is your thought process on this as people really are having these conversations with their family members about what they're going to do?
Yeah, these are really tough conversations. We are so used to getting with family members and other loved ones during the holidays that these are really tough conversations and tough decisions. I think the plans, the recommendations that are in place now are keep your gathering small, so less than 10. And if you are celebrating with people who are not your family members, you have to follow these rules that I just outlined. Wear a mask even in your house. Stay away from people even when they are in your house. In the best of all worlds, those folks who can cancel their plans and do something virtually, that would be better.
All right, we do want to hear from those of you who have COVID questions. We want you to text those questions. We have a few minutes to be able to answer them. 379-5775. This first person is asking, will the pneumonia shot or flu shot help prevent COVID?
No. The COVID virus is its own virus. It has its own DNA and protein makeup, and the vaccines that are specific to coronavirus are specific for coronavirus, and that's true of pneumonia and influenza viruses as well.
This person says many students are back or plan to go back for in-person learning. Based on the rising case numbers, should districts be considering a different course of action?
Again, great question and a really tough question. And the folks who are making those tough questions in regards to going back to school have their hands full. Is they have to figure out how they will keep people masked, socially distanced while at school. That seems like a really heavy lift, and the better course of action, at least right now, might be to consider continue virtual learning if at all possible.
This person says, I have Crohn's disease and I take an infusion every 4 weeks. I'm extremely worried about getting COVID. What are my chances of contracting COVID, and how much sicker would I be if I was exposed to it?
Yeah, first thing I would say is we probably don't have deep data around people with your particular condition getting COVID. I would say that people with Crohn's disease are thought to be immunosuppressed. The medications you're taking may make that even a little worse. And so you especially and your family members and loved ones need to follow these rules about wearing a mask all the time and staying away from each other. It could be concerning that somebody with a comorbid condition gets COVID and gets even sicker than they would without the comorbid condition.
Okay. So this person is saying, is there an expectation that cases will continue to go up during the winter since more people are spending time indoors?
Another good question. The short answer is yes. We have evidence now that the rate of spread is increasing. We follow this data every day. We know the rate of spread in the communities that we serve and in your viewing area, and we know it's getting worse. And so that everybody who gets coronavirus is giving it to more than one other person. So that is a spread. And we think that people going indoors, sharing closed spaces, that's only going to get worse unless everybody is diligent about wearing a mask, staying away from each other.
You know, when you hear the Department of Health and Human Services talk about it during the governor's updates, Mandy Cohen makes it really clear. She's like, you can't trust people, and it's not about trust. And I think we all have a hard time with that because we think this person wouldn't give it to me.
Great point. Is today's world, we need to assume that everybody has coronavirus. They may be asymptomatic. They may feel great, they may look great. And with those people, everybody needs to wear a mask and you need to stay away from them. Just assume that everybody has it and pretend it's that way, and everybody needs to wear a mask and stay away from everyone else.
I know they've also been talking about people getting tests either before or after they come back from Thanksgiving. If they test positive when they come back from Thanksgiving, but they are not having symptoms, how long is it that they need to wait before they come back to work?
Yeah, it's a good question. I would, the first answer would be 14 days. Most folks will have access to some sort of health system at work that can give more specific advice. I would also be concerned that person who comes back and tests positive likely infected everybody that they were with during Thanksgiving. And so there is the return to work issue. There's also the what happened at the Thanksgiving gathering.
Mm. This person is saying with the news of a pending vaccine, there's that news of the equipment of super cold storage of the vaccine. Is our healthcare infrastructure prepared for handling that kind of equipment?
We think initially the answer is yes. We have a robust plan for distribution of the vaccine, and I think most health systems do. And keeping this virus at close to minus 100 degrees Celsius will be a challenge, but it's doable. But it adds some complexity to the distribution plan.
So if it goes above that degree, does that mean that it is not worthy to be used?
It depends on the time frame, and so it has to be super frozen, and then it can be thawed and given. But there are specific administration instructions that have to be followed.
So this person follows up and says, is it normal that these have this kind of extreme cold storage? Are there other vaccines that need extreme things that we just don't really know of?
There certainly are medications and other things used within the medical industry that have to be super cold, and it's not frequent, but it's also not the most uncommon thing we've dealt with.
This person is asking, is there any more data that can tell if people can contract the virus more than once?
Still really unknown. There's still some anecdotes where that's maybe a possibility. The thinking is that folks are immune for a period of time, and then we don't know after that, and time will tell.
Okay, and then they asked, when do you think the general public will see the vaccine if it's available? I mean, we were hearing today that some healthcare workers could possibly get it by the end of this year, and that most likely it was going to be spring 2021, but I don't know if you have any other thoughts on that.
That's probably a good guess. The first aliquot of immunizations will be for people at risk in their jobs, and then it will be high-risk people in the communities, and then it will be distributed more widely after that.
All right. Thank you so much for taking your time today. We so appreciate you. Oh, wait, we got time for just one more question here. So they wanted to know, let's see, is it possible to detect COVID-19 when you get tested or when you get your flu shot?
Certainly testing, you can find out. There's no plans to get flu immunization and COVID testing at the same time. So again, I think the message with COVID is stay away from each other, and everybody has to do it. So be diligent about it. Remind your family and friends, people who are out in the community that aren't wearing a mask, really need to wear a mask and be reminded to do so.
All right, thank you so much. We're now at the end of the time. I'm glad we got that one last one in, so thank you for that. Thank you for joining us today. WFMY News 2 at 6 is coming up right after this break.